something when I came into By the Bay Health that I found was pretty unique was the reality or realization of how important community physicians are to staying connected with By the Bay Health and the entire clinical team and the patient and the family. And from what I knew, that was very different from other hospice agencies. I would love to know from you, where did that start? Because a lot of hospice agencies, when they onboard a patient to their hospice agency, that physician becomes the physician of record.
Yes.
And they kind of extricate the physician in the community that might have been their primary care physician for 20, 30, 50 years. And at By the Bay Health, I think it's a differentiator around they understand that that meaningful partnership and relationship that that physician has built with the patient and their family is really important. So we keep them the physician of record, and our physicians really connect really beautifully with them. And I just think it started somewhere. So do you remember where that kind of started or why that was such an important component of By the Bay Health's model?
It started from the beginning. And the reason it started from the beginning is because physicians do not want to lose contact with their patient at all. And if, again, you're going to make an impression on that referring physician and please him or her, it is important that you stay engaged. And it's never changed. And I know that. Again, I have an example of somebody who would not go to hospice care because they had to give up their physician. And it's an important component. And again, the attending doesn't necessarily have a lot of time to stay connected with his or her patient, but they are connected. Mm-hmm. And they're always they're informed along the way what is happening. So it's from the beginning.
Another significant differentiator that I see at By the Bay Health versus some other hospice agencies that I've worked with in the community is around the deep integration and continuity among all of the clinical team members. It just feels like everyone is in the know. Everyone understands the needs of that patient, and not one of those clinicians is left behind in keeping the patient at the center of the care. So could you talk a little bit about kind of how that started or why that was so important for you to drive in the vision of By the Bay?
Well, initially it became a training circle, if you would. And so all of those involved in caring for the patient, or all patients, the teams were small then, but it became an educational program, so to speak. It was support and it was a sharing of information, but the medical director could often, educate about something. The other clinicians could share their knowledge about something. And so it just really started that way, but it's supportive for the clinicians also, because if you're carrying the worry about a patient and a family it's heavy and you need to discuss it, that's where you do it. It's a confidential service of support and education. So that's where it's been.
I love
always.
I love it.